everybody. Welcome back to SHARC Doc Talk. This is Doc T, along with Dr. Deonton over here. And we have a special guest, Mr. Randy Wong, joining us. He is a patient of the clinic, also kind of a friend on the side, too. So we wanted to invite him in and have him kind of share his experience with you, with us, with you. And so we're going to have him come in here. We have a few Q&A for him. We'll probably go riff a little bit because we all love whiskey. So we'll have a little talk about that, I'm sure.
Sounds like a plan.
And we all love sports as well. So we're going to start off with who you got in the Super Bowl.
I am leaning Seattle.
All right.
I think they have the better defense, the more full all-around team.
Sure.
So I am leaning towards Seattle.
Yeah, I think we're the same so far. Yeah. Plus, we have a little I kind of have a tie being in San Clemente with Sam Darnold. The whole community knows him, loves him, so we're kind of like, and I want to see him. They did him wrong last year, so I want to see him get one in there.
They've done him wrong the last 5 years.
Yeah,
absolutely.
Yeah,
absolutely.
It's been rough. Yeah. So, anywho, Randy, what brought you to our clinic?
Over the years, I've always had back issues. Growing up,
Okay.
I was playing a lot of sports, and I would say taking care of myself was the last thing I thought about.
Join the club, yeah.
I would say that that's one of the things. Us growing up, we're like, oh, I'll be better tomorrow, or it'll take a day or two and I'll be fine.
It'll go away.
And then there was just one day where I was just walking I was probably early 30s, just walking around my office, and there was a twinge in my back, and then just completely went out. I couldn't even walk.
Oh man, that's
Just
the worst.
went down, went to the doctor, got an x-ray, and the only thing he told me was, oh, you have arthritis in your back, it's not going away. And that was his only explanation.
Huh.
Gotta love that.
Right?
Everything's arthritis.
Right?
Yeah.
So that was the main explanation I had, other than, hey, don't do this, do that. This is how you got to get better. You know, years on down the line, one of my close friends, Eddie Wong,
Oh yeah.
brother from another mother, he was coming to see you for a while.
Sure.
And he asked if I wanted to, come in and have a consultation.
Right.
And that's how I came in the door.
Nice.
At first it was maintenance,
Right.
just to make sure that.
Could you just be clear, your back pain had kind of resolved already, so to speak.
A little bit. I wouldn't
Okay.
say resolved. I would say it was masked.
Okay, fair enough.
I think that's a better way of putting it.
Okay.
Because it did come back.
Yep.
As you know, it did come back. So, coming in, I was trying to see what I needed to do to strengthen, as you're saying, the core, the glutes, power everything up so that it doesn't happen or occur again.
Mm-hmm. Mitigate that risk.
Right. So that's what brought me in the door.
So what were some of the stuff you were training or were doing prior? Like what kind of exercising? What kind of things did you do?
Oh, it was probably sports and weightlifting.
What sport?
I actually played roller hockey.
I wouldn't have guessed that.
Yeah. I grew up playing roller hockey, basketball,
Okay.
flag football.
Nice.
'Cause, I'm too little for tackle.
I know the feeling. Yeah.
So a lot of those, and weight training,
Okay.
And with weight training, you're growing up with your friends, and they're about, 6'1", about 230. They're putting up 2.5 plates. Try it.
You'll be fine.
You'll be okay.
What's the worst? We actually just did a podcast on training smarter, not harder.
Right.
That would be right in line with that.
Exactly.
Yes.
But growing up and you're young, you're
Yep.
okay, well, I'll do what I can.
Mm-hmm.
And, the thought process back then was, 10-8-6? Or,
Oh, reps
remember
and
those?
stuff. Yes.
Remember
Yes.
those? 10-8-6. You lift until you can do 10-8-6, then you move up.
Yeah.
See? You understand. So
Yes.
it's 10-8-6 or 10-8-4 or 10-8-3. Whatever you can do.
Did you get up for one? Okay, go
Yeah,
on.
exactly.
You'll be fine.
So-
Just keep going.
That was the plan, right?
Right.
That was always
Right.
the plan. So that's what probably, I wouldn't say started, but kind of added to.
Oh, it's where it started.
Right.
Yeah, when we have patients and they ask, I'm not really sure when this started, and I'll say,
Yeah.
well, what was your past like?
Right.
And those are the scenarios where they go, nope, there he is. It's not always a direct trauma.
No.
In fact, rarely is it a direct trauma. It's usually something you've done on your own, kind of an alley-oop. I call it the alley-oop dunk. And so you find it. So, all right, let's get into our questions here.
Sure.
Sense of, okay, we got that covered nice. So how long have you really kind of have back pain, over the years?
The last few years?
Like your life?
Oh, it's probably started early 30s.
Okay, it's not bad. How old are you now?
I'm 48.
All right, congrats.
I made it.
I mean, you just turned 29 yesterday,
29.
Thursday.
Oh, okay.
30 days on the door.
All right. So
Yeah,
your back
yeah.
pain starts in 2 years.
Yeah.
Yeah, well, he's trying harder than that, isn't he? He's trying to beat us both.
Right.
See what he can do there.
All I know is I can't skip my warm up anymore.
Yeah, right.
Oh.
Oh, dude. I was like 31 and 32.
Yeah.
I was a little lucky, but I wasn't powerlifting, so
Yeah.
I wasn't pushing that hard. But I had to warm up, and I noticed a distinct difference at the
Yeah.
gym I didn't. And that's actually to the question we had on the last podcast, too, people saying, like, what do you do? If you're in your warm up and you're not feeling good, there's your sign. If the warm up isn't starting to make you feel like, okay, let's do this,
Yeah.
then let's go ahead and not do this. That's a simple, I always say to patients, when in doubt, don't. It's simple. Just
Yeah.
so simple. Anyway, so for you, sir, when you were coming here and you had some referral from family or friends or people that knew you, but even still, you also had the other side of things of PT and the other versions of medical stuff. Were you skeptical or doubtful or anything like that coming? Nervous?
Nervous would probably be one because, with medical, as a novice, I don't know.
Sure.
Yeah.
And when you don't know, it's like blind faith,
Yeah.
right?
Yep.
It's literally blind. I'm coming in needing your knowledge,
Right.
Yeah.
right? I'm coming in asking for your advice because that's what I'm looking for because I don't know what's going on.
Yeah.
Right. Well,
Right.
give me
So-
an answer, maybe. I think that's what's tricky with the medical model is when you come in with a picture or you come in with something like that, you get this pseudo concrete answer.
Yeah.
Oh, it's arthritis. It's this. And you go, oh, cool. I got it. So I'm not going to feel any better right now. I don't know what to do still, but for some reason in my mind, I've got the knowledge now of what this is.
Yeah.
And that's somehow going to make me, I guess, better.
But with that, they were almost like, it's not going to get better. You just got to deal with it more than anything.
Oh my
That
God.
was the
don't even get me
mentality.
started. That's where you're going to get
That
30
was-
years of me in motion right now.
That was the mentality that they kind of gave you.
Yes.
You know,
Yeah,
with
100%.
that diagnosis, that's the mentality they're giving you. That I can't help you. You got to help yourself, and you have to deal with what it is that your pain is.
Yeah.
That's basically what that came to, and then coming here was a lot different.
Oh, yeah.
You
How
know?
so?
To the fact that you're telling me, okay, well, this is what caused this. You're treating me a certain way so that it's specific for me.
Right.
And we've had that conversation
Yep.
where it's like you're hand holding each individual person to their own individual diagnosis.
Right.
And that's what makes me feel like I'm comfortable here.
Oh, that's
Yeah.
good. That's always, even if, like, I've known you a while now, but even hearing that from patients I've had for 20 years, it still makes us feel good.
Yeah.
Because it tells us that we're still doing the thing we're supposed to be doing, which you'd be shocked how many doctors I've seen over the years kind of fall off, So that's always good to hear. Thank you for saying that. That's always great. So what did you learn about yourself going through this process?
That I need to hold myself more accountable.
Okay.
I think that's the biggest thing. And I
Yeah.
think you've probably heard that from other people where you're like, okay, you have to do this, you have to do this. And then the follow-up, have you done this? Have you done this?
Right.
Right?
Yes. It's like
So
a
it's-
nagging mother.
It's more, yeah, it's about accountability for
Yeah.
yourself,
Yeah, I mean-
because you're the only one who can take care of your own health.
Yeah.
Yeah.
And pain relief is one thing, but
Mm-hmm.
fixing why you keep having the pain. Yeah, because having low back pain, especially like over and over again, it's miserable. And you had I mean, you're here, so I'm allowed to say this, but you had a bad one. Yeah, you had a rough go of it the first time around.
Yeah.
The second time around wasn't as bad, but that first
Yeah.
time around was brutal.
Yeah.
I felt for you, man. That was tough.
Yeah.
All right, so now you look back, you got the accountability, and I'm going to ask you right here on national TV, right in front of the camera, are you still doing your exercises?
I am. As frequently, probably not as you were saying.
At least you're
think,
honest.
But I am doing my exercise.
That's good. That's good.
Because as you can, the consistency of coming to see you the last, coming back,
Right.
that has helped me stay on track as well. It's consistency, right? Because
Yeah.
I
I
agree.
think over the last, since the smaller relapse, I don't think I've missed an appointment again.
Very, very. So the maintenance side of things is something that we really started to push in the last year with a lot of patients because of stories like that. Because at first I always felt uncomfortable kind of selling them on this, hey, come in every 3 weeks and blah, blah, blah. And it's like, you need to, but it was weird for me because it's not how I look at things.
Yeah.
I'm like, you're paying me to fix this problem. I fix this problem. And so people like you help me understand this maintenance process that people are like, yeah, it really is a good thing. How do you feel like that's helped you, like more specifically?
Again, it's the mindset, right?
Okay.
Because I know I have to come in, and if I got to see you, I'm going to get asked the questions.
We will ask the questions.
Right. So, in self-defense of, are you doing it? The answer has to be yes. So you got to keep doing the exercises.
Yeah.
You know?
Yep.
Because if you don't, you know what's going to cause what's going to happen again.
Yeah.
Potentially.
Yeah. And it's the worst because, I mean, we had you at one point deadlifting, what were you pulling off, 95, 115 off the floor?
Yeah.
Yeah, you were pulling some weight off the floor.
Yeah. Yeah.
It's amazing. Yeah. Then we had a little digression, and
Yeah.
but we're out of it now.
Yep.
So
We'll get back to it.
That'll be fun.
what part of our process here did surprise you the most?
I wouldn't say surprised because, after getting to know you guys and, it's like I said, everything is tailored to the person.
Sure.
I think that was probably the best part of it. I've always said, what you get out of, the treatment is what you put in, but it's also what they put together for you.
Right.
It's tailored to you.
Right. Couldn't
So-
get that online.
Yeah.
It's hard to do that with a Zoom call or
Right.
Yeah.
Yeah, like-
that's just the tip of the iceberg.
Yeah, yeah.
It's
You,
phone
you
call.
want
Can't
you want
imagine.
you want YouTube therapy? Good luck.
Yeah.
Yeah.
It's like you might find something.
Right. I
you
mean,
get
they'll
lucky every once in a
yeah.
while.
yeah,
I
they'll
agree.
they'll
I agree.
diagnose you.
Yeah.
Oh
Oh yeah. The algorithms I get to pop. Are you 0 to 5, 15 to 24? I'm like, I know as many broken 29-year-olds as I do 48-year-olds as I do 52-year-olds. Like it's not the ages, nothing to do with it. It's more like, are you smart or dumb in the gym? That would be a great first question. Yeah.
Or are you even getting to the gym? That's another question.
So let's see if I can think of anything else. When you were playing basketball and doing things like that, did it ever cross your mind that you needed to get stronger in certain ways? Or when you were younger, was it just like, I got this?
When I was younger, it was more about repetition, and I mean, I never had a strength coach.
Right.
So, everything growing up was learning on the fly and learning on my own. I've never had any real, training other than a high school coach here and there.
Sure.
You know?
Yeah.
But after that, everything's on your own. Like when I said, when I
Yeah.
learned how to play hockey, it wasn't anything formal. It was I learned how to play and skate at the same time.
That's the best.
Right? It was amazing. I'm lucky my neck is still intact.
Oh, we've all done it.
It is funny when you pick up a sport like that you
You
never
know?
really played and you start learning on the
Never.
fly, literally.
Right. And then, you figure it out.
Yeah.
I actually, learned how to skate, learn how to skate backwards, slap a puck.
So ask this, if you were going to send a friend in or a family member in, how would you prep them?
How would I prep them?
And to be completely honest, because the first question I ask anybody who's been referred by somebody else.
Mm-hmm.
So what would you prep them with?
Be ready.
That's the best way.
I would probably say be ready, because coming in here, you know that they're going to try to, if you're hurt, they're going to try to get you better. If you're in need of training, they're going to put a plan together for you. So be prepared.
Right. And we put a lot of, David does the same thing. We put a lot of onus onto the patient.
Yeah.
And well, my first question is, do they tell you how much this hurts? Because doing what we do with ART and some soft tissue stuff, like it's not a comfortable process by any means whatsoever.
Yeah, I
but-
felt it firsthand.
Yeah, it's one of those like, wow, I didn't know that'd feel like that.
Yeah.
But we look at it and we go, okay, hey, we're going to go ahead and figure out how to get you back and out of pain and get you out of But the accountability we put on them, and I tell them all, you're going to have homework. So if you're not a homework person, you're going to become one because you kind of have to.
Yeah.
Because the one thing that I think people always laugh when they first meet us and maybe haven't gotten all the insight is we'll be doing rehab 3 or 4 times a day, 5 times a day. And they always go, why is that? I said, because you're going to spend the other 20-something hours messing it up. So I need you to keep repeating it over and over again. And that comes in the consistency
Yeah.
side of things and what we're trying to actually figure out.
Plus,
and
it,
it's-
plus it builds habits. So,
yeah, I mean, everything is really
Yeah.
a habit if you think about
Yeah.
it. Yeah. So, all right. And anything that we didn't do that surprised you that we didn't do?
That's a good question.
Yeah, that is a good question. That I didn't do? Make me video myself doing it.
I might have to start implementing that.
Yeah, I think we are. I actually have always wanted that model of like having an iPad
Yeah.
and
Yeah.
just videotaping the whole shindig.
Right.
But it can get complicated and
can.
HIPAA laws and all
Yeah.
kinds of other stuff. So it gets tricky. That's
Yeah.
what we're going to do on their phones now. But it is a tricky one. But yeah, we actually sometimes usually get, you didn't adjust me.
Yeah.
And I go, well, first of all, if you have a hot low back, if you come in, you can't stand up straight. And all that, I'm not going to adjust you because that's not the problem.
Right.
Yeah, so we're not going to mess with that. But yeah.
But it's more, I mean, like for the accountability part.
Yeah.
Hey, you should video yourself doing this at home. And
Interesting.
And
I started to ask patients.
Yeah.
that.
I didn't get that at all from what you said.
That's what I was.
And you picked
that's
up on
what
that. Damn.
Yeah, you're a little behind.
It happens.
You know, 52, you slow down a bit.
I can't quite remember yesterday.
Oh yeah.
Like I
But-
actually lost my wallet,
Oh,
but I didn't. I put it in a different pocket in my backpack.
oh.
That's all it takes to throw me off is put it in a different pocket. Like the thing's there.
But that's kind of what I was mean. Like if you want, that's part of the accountability that we're talking about at the beginning, right?
Yep.
If you have that person, okay, 12 o'clock today, video yourself doing the exercise that I asked you to do. Will you video yourself doing it?
It's not a bad idea.
That's started to. I usually do it with my powerlifter athletes just because they already do that anyways.
Yeah.
So I just ask for it. And that went on, but we might throw
That's
something
not a
at you
bad
guys.
idea. Technology I'm behind on technology. I still don't even know what this thing does. I
Yeah.
just text on it and occasionally talk on the phone, take
Try to
pictures.
close it every so often.
I miss the flip phones.
Yeah.
Yeah. There's nothing more exciting than hanging up on somebody with a flip phone.
Yeah.
Because you can like
Yeah, now
slam
it's
it
just-
shut. Now I'm just pushing the button really hard and it doesn't do anything. Yeah.
Yeah,
Don't give me a flip phone.
that slam is pretty good.
Yeah.
And they hear it too. They hear it when it clicks.
Oh yeah. Yeah. I was like, whoa.
Was he mad?
Another stories. Yeah. So that's good. That's good here. So if you were to say, I'm trying to think of a way to phrase this, what would you tell yourself, learning what you've learned from us, what would you tell your 20-year-old self?
Don't be an idiot. You know, I mean, you can say you're going to do it.
Yeah.
If you're going to do it right.
Yeah.
I mean,
I mean, I know the saying like anything worth doing right.
right.
And I was like, kind of laugh like it's not wrong.
Yeah.
Yeah, it's not wrong.
Because I've, like going in your 20s into the gym, you're like, okay, I can do this, but but then you start arching a little, or you start leaning a little, and then you're like, oh, I did it, but did you actually do it?
Yeah, you might have missed something there.
Yeah, that's completely fair.
Yeah.
I know you mentioned that we gave you exercises to do at home, right? How is that experience with us just like going through that with you rather than just giving you a sheet? Because we don't just say, hey, do these exercises at home and you're done.
No, yeah, it's that's a good point. It's very helpful,
Yeah.
because then it gives me the the feel of what you need to be doing and how it's supposed to feel when you're doing it,
Right.
versus like you said, here's a sheet or here's a YouTube video, look at it, watch it. That's how it's supposed to be done, but you don't know
Yes.
how it's supposed to.
Feel.
Yeah,
Yeah.
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 And 900,000 most of the
All of
time, like very 0.001% gets it right. But yeah, they'll come back on a second visit and we're checking the rehab again. And almost everybody's still doing just a little bit off. Because it is I don't know where I got this in my brain years ago, but it's like how you do it is more important than that you're doing it. And how you do it is one of those things that like, it's kind of a trip because when you go through it with people.
sorry. No, good.
What are you thinking?
I was just looking. Side note, do you guys have a sliding mirror anywhere around here? Because one of the things I'm a visual person too.
That's good. We do have a mirror. It just keeps moving.
we just throw it there.
Yeah, something like that.
Places.
Just if someone's doing an exercise, either put the mirror in front of them, and then they can see how it's supposed to be done.
That's a great idea. I always laugh back in the day because I come from a CrossFit background way back in 04, 05. And it was funny because no gym ever had a mirror. And I was like, of all the workout regimens I've ever seen, this one needs a mirror. Because if you could see how bad you look right now,
Well, the form,
you would stop.
The form
Yes.
is.
You'd be like, wait, I'm moving like that?
Yeah,
Oh, never mind. I need to
that's-
stop.
That's
Yeah.
like straight swinging.
Yeah,
You
this
are
is not
straight
good.
swinging.
Oh yeah, I
That
think
is
part of
very
it for those gyms, they say it's for safety. Because if you're bailing on,
Well, what's funny, I'm bailing on
Yeah.
oh my God, memories. Like I have so many memories, like just shotgun blast memories of all these instances, like things that ever happened. Nobody ever, because they're always big warehouses, nobody ever dumped it, went rolling.
Yeah.
Yeah. But yeah, anyway, yeah. So the mirror thing, like good. I actually like the idea of the mirror. That's why I want to have a patient on because as much as we can pick your brain and chat with you in the room, whatever, it's nice to have somebody come on and give us other things that we're not thinking about or what would help with that process.
That's right.
Because it is true. If you're a visual learner and you get to see yourself move a little bit, that helps, which is like videotaping and going home with
Yeah.
that is always a nice thing too because I can walk them through like it's almost like a one-on-one soundbite that you can go kind of do again. But all right, cool. Any other recommendations for us there, sir?
No,
That's it?
That's good.
I like that.
Yeah.
I like that.
All right. Obviously, you came in with a bunch of back pain.
Yes.
And now, not so much. How has your life been different since then?
Just getting back to normal. I think that's the biggest part. I think that was one of our first conversations is what you're going to do here will get you more in line with your normal life.
Yeah.
You know, because he knows one of my favorite things to do is golf.
Yeah.
You know,
Yeah.
and every time before, I'd be like careful when I swing. You know,
It's in the back of your mind.
yeah, in the back of my head, it's
Yeah.
like if you swing this, it might come back. You know, now I'm, 2 years out, I'm swinging more free again.
That's me. It is funny.
You know?
We talk to patients on initial visit, like, how has this pain affected you? Because it helps us understand the psyche of what we're dealing with. Because pain sucks, and it gets scary, and then it'll attack you in these moments like that. Like, I'm gonna go play golf, or I'm gonna go play basketball.
Yeah.
Like, I'm afraid my knee's gonna do something. Or I'm afraid my back's gonna do something. Right? It's like I'm playing volleyball. I'm afraid my knee's gonna do something. It's like you get these little fears in you, and the worst thing in sport is when you play with fear. It's not fun anymore.
You're not playing free.
No. And it just doesn't. Yeah, and that's the part of life that you need to be doing. So it's an interesting mindset, because when we look at a patient, like you, for example, I'm coming in, we know each other, so I'm joking with you, whatever, but in the back of my mind, I'm thinking to myself, am I seeing him move the way I need him to move? Is he able to do the things I need him to do so that he can go do the things he wants to do? And if I don't see that, that's my job to make sure we're correcting that. And it's interesting because people will ask for like, can you just write me up a program for like a month or two? And I'm like, I can't really. And they said, why? I said, because I don't know what's going to happen with you. Like, you're not there yet, and we haven't really uncovered everything. We've only uncovered a few things. So if I give this to you for 6 weeks, you might last 2, and something's going to, like, tweak my neck. Now we got to do something different. So it's a tricky little world when it comes to dealing with the body and people, because people are people. You know?
And every so often I've come in with like these little nagging things.
Oh,
Remember
those are the best.
The hand and the shoulder and
Yep.
this and that. And you're like,
Yep.
all right, well, now we got to adjust.
Yeah.
Now we got to fix this for a little bit.
Yeah.
And then they go away. And
Yep.
but always coming back for the normal maintenance.
It's so funny. I don't know how I was a hard-headed guy in this one. Now I love maintenance.
Yeah.
I tell them, like, you need to come in. You're going to do these things. I have 2 guys right now, ironically, that know each other. Ironically, both from Boston. So you know who they're rooting for this weekend. And they have the accent, too, which is hilarious.
Yeah.
But both of them had their wives come in, and the wives actually thanked me because I got them to actually do the things they needed to do to stop complaining. They thanked me for them not complaining anymore, not for helping. Just the complaining part. So, because we had one guy with a knee replacement, and the other side's going bad. Now he's playing golf with his family. He's doing fine. The other guys want to get exercise and move it again. Same kind of problem with the knees. We got him doing great. So we have this nice little cycle that's going to keep him going because they truly, like one got a replacement, one has arthritis, truly. 70% of the joints kind of jacked up a little bit. So he's there. There's no reversing that. However, I can maximize the hell out of what his 30% is. And that's someone like you. We took you from years of kind of beating yourself up, and you kind of finally got to a point like, I need somebody to look at this because I got to figure out what's going on here. And now your world changed because you're more conscious of your own body, right? A grown man, and you're like, I got this now.
Yeah.
And now you have what we are the enablers. You have the confidence knowing we're here, so you might go do that one thing.
Right.
Which every time I think I see you, I remember, don't do this. Yeah, you know what I'm talking about. So yeah, golf's tricky too because it's such a rotary sport. And you're a guy. I mean, you're. I almost said, what do you do for work?
Oh, I sit a lot. I do insurance.
Yeah.
So I'm a desk person.
Desk and computer and texting. So it's a whole day thing. And if you get into something, putting something together for somebody, you're going to literally sit for 4 or 5 hours at a time. And so those little things are so hard to combat.
Yeah.
That it's one of those things. It's like, okay, cool. I never thought about the video thing. I'm pissed about that. Just never thought about it because the technology in this doesn't register in my brain that everybody literally, this is an appendage.
Yep.
This is our, they always have it. And
I guess we're implementing it now.
yeah.
Thanks, Randy.
Things you learn, right? Yeah.
I'm going to teach him how to do all the small stuff with it.
Okay, do you really? How do you do that? How do you airdrop? I have no idea. Do you want to airdrop this? I'm like, no, I don't know what that means. Anyway. So, all right, sir. Well, I've got nothing else for you.
Yeah. So I got like 1 or 2 questions here.
Sure.
Well, please chime in.
Obviously, we kind of talked about your process here. You kind of talked about everything that you've learned here in terms of exercises and accountability. For the person that's just like on the fence about coming in, like what would you tell that person?
Do it. Just give it a shot. I mean, the worst thing that could happen, right, is you learn something.
Mm-hmm.
I mean, that's the honest truth. The worst thing you can do is learn something.
Yeah.
Yeah.
You
And
know?
that's honestly our intent in life, I think, is just to educate them on that piece.
Right. It's
Yeah.
all about education,
Yeah.
and education is one of the biggest things you guys offer. You know.
Oh, thank you.
Yeah, I appreciate that.
Yeah,
appreciate
very
it.
nice.
And I appreciate Randy coming in because what was funny was he helped with my golf swing.
Did you really?
Yeah. So remember the OCFA golf event?
Oh,
I
yeah.
was just trying to get some swings in.
Oh.
Yeah. He saw a couple. I was like, yeah, do this. I'm like, oh, great.
Well done.
Granted, was I like killing it on the course? I had one really great shot.
There you go.
Outside
Yeah,
of that.
that's more than most. on
Yeah,
golf.
That's
Yeah,
what
it's-
brings you back to golf.
Yes.
Yeah.
You get that one
Yeah.
shot and you're like, I can do this better. Or, I
Right.
got this.
Right.
Well, what was funny is because it was a scramble, right? And we had a couple like pretty good golfers on our side. One time they used my shot. I'm like, you see that, guys? You see that? We're doing it. That's mine.
Talk about something you should videotape.
Yeah.
Yeah.
Absolutely.
But yeah, so we appreciate Randy in the office too.
Yeah. Oh,
Not
yeah.
just,
Yeah.
not
Randy's
just as patient.
absolutely.
Yeah, Randy's great. It's actually funny. The Wong family
Yeah.
has been unique.
Yeah.
Your brother's interesting, much the same.
Yeah.
So I saw him I think a couple days ago, but he's
Yep.
he's doing better.
Yes.
But yeah, it's that hard talk because that poor guy is
Done a lot.
he's beat himself pretty good too. So
Yeah. I'll leave that to your conversation with him.
I guess
comment.
I guess the question is, since you guys are brothers, did you push each other too much when you guys got injured?
Oh, we were competitive. We were competitive.
Yeah.
But yeah, we trained together. We played ball together. We did a lot of it together.
Nice.
Yeah.
Yeah.
Yeah. Growing up together.
And
So,
that brother, I mean, I got my two sons, and they, they push each other. Yeah, now they wrestle a lot, and
Yeah.
my younger son is not there yet, so he gets his butt kicked a lot.
Oh man.
Yeah, a lot. I kind of feel for him because I never had a sibling, so I don't understand that rivalry. Because you're older, or younger,
Older.
older. Okay, by how many?
2 years.
So did you just pick on him?
No, we were pretty separate growing up.
Okay.
Yeah, it was more afterwards that we started.
Oh,
No.
Yeah, more toward the college years.
yeah. You're a little more dangerous.
Yeah.
4-year-olds punching each other is not dangerous.
Yeah.
24-year-olds, that might hurt. Good thing you, Mark. That's great. All right, sir. Well, hey, I really appreciate you coming out.
Absolutely.
We
Thanks
did
for
learn
having me.
some. Well, we need a sliding mirror now.
Yeah, or just a mirror in general.
Yeah, we just haul that thing around, I guess.
I don't
I'll
want to
get
keep
more
on
than
it.
one, though.
Yeah.
All right. Thanks for adding more work on my plate. I appreciate it.
No problem. That's
All
what I'm
buddy.
here for.
Well, hey, thanks for coming out, honestly.
Absolutely.
Yeah. Good?
Yeah, I'm good. I have nothing
Cool.
else to ask.
All right, cool. Hope you guys enjoy this. Again, Randy Wong, patient of ours, comes in,
And
tells you
friend
what's going
now.
on. What's that?
Not just a patient, a friend now.
A friend. He's a golf instructor.
Yeah.
Yeah.
Yes.
You gotta love that. All right, yeah, you can hit it.
All right. Yeah, and
Love
we're
that.
out.